First, I would like to sincerely thank PolyU and HKIE for giving me such encouragement and a valuable opportunity. I will treasure this opportunity and work to further broaden my knowledge in engineering field. Now, I would like to take this opportunity to share my studies during the past year at PolyU. Despite the effects of COVID-19 pandemic, I am happy that face-to-face learning in laboratories were resumed, since I will be able to have a greater learning experience through hands-on practice and trainings. During the past year, I have taken part in a research and design project where our group designed a finger exercise gloves for older adults with osteoarthritis. The aim of the device was to allow the elderly to do finger exercise independently with appropriate exercise habits such that treatments could be carried out more efficiently. For the device, bend sensors were used to detect the angle of finger joints on the thumb, index finger, middle finger, and a low cell was included for the detection of the user's hand grip force. Moreover, a program was created for this device. On the program, real-time data was shown with a numerical and graphic format at the front panel. Furthermore, there was a notification panel with green lights on each finger joint. As a result, the user was able to know whether their hand posture was correct and whether their finger joints had been fully bent. Through different trials in this project, I have been able to learn more about various sensors such as bend sensors, pressure sensors, and force transducers. In addition, I have become more familiar with programming tools such as the Arduino and the lab wheel. On the other hand, I have chosen the prosthetics and orthotics stream and have attended the related program last year, where we focused on learning about orthotics. Apart from studying anatomy and different diseases, I spent most of the time practicing the manufacturing process of orthosis. There are many different types and designs of orthosis when tackling different disorders. For example, UCBL shown on the left is commonly used for flat feet. On the other hand, the AFO shown on the right is usually prescribed for the cerebral palsy patients. From this laboratory practice, I learned an important attitude as an engineer, to not be afraid of failure and keep trying. At first, I failed at casting and modification, but realized that my skill had improved after repeated trials and practice. Furthermore, I attended an 8-week clinical placement. At first, I was nervous when facing real patients. However, I became more confident after providing several services towards them, and my communication skills also significantly improved. I am especially pleased that I was able to apply my knowledge to help people in need. Besides, as a biomedical engineering student, I am interested in current technology of rehabilitation in Hong Kong. Therefore, I joined the technical webinar, the latest robotic technologies application in rehabilitation and elderly care, which was jointly organized by 3 divisions of HKIE. Here, different rehabilitation technologies was introduced by Mr. Alvin Chen, the co-founder and CEO of Handy Rehab. One of the robot hands introduced was used for the rehabilitation of elderly stroke patients. When the user's brain sends signals to the muscle would react accordingly. However, a stroke patient's hand may not work well, so the EMG sensors would detect the signal and assist the user's action or movement. Finally, the sensor signal would be sent to the brain and reinforce the motor learning. This device could be used for several task-based trainings and was tested in some NGOs in Hong Kong. Through this opportunity, I was glad to be able to learn about these updated technologies and further understand the current situation in Hong Kong. Finally, I would like to thank PolyU and HKIE again for giving me such encouragement and opportunity. I will persistently do my best to study and enhance my engineering knowledge. Thank you very much.